The second topic that we are going to take today is NHFS 5 survey report. National Family Health Survey 5. Recently, the report of National Family Health Survey has been released, and we are going to look at what is this report, who releases this report, what are the basic findings of this report, and how is it going to affect the socio-economic and socio-political milieu of the country, right? Why news? There are three important news headlines that I have taken from two different newspapers, India Today and Indian Express. In India Today is of course not a newspaper; it is a magazine. I have taken that from online portal, right? Declining fertility rate, teen pregnancy. What the new National Family Health Survey reveals. That means the new National Family Health Survey NHFS 5 that was conducted between 2019 to 2021 has released that the total fertility rate and teenage pregnancies have been declining. That is a good news, right? Second news is NHFS 5 data. Total fertility rate dips. Sharpest decline among Muslims. That is one specific community, Muslims community, has seen the sharpest decline of fertility rate. The third headline is barring some, underage marriages down in most states. This is state related data. That means in most of the states, underage marriages, currently the marriage age is 18 for women. Okay, so that has been what? That has been falling down. The National Family Health Survey is a very optimistic survey at this point in time, because this survey basically reflects the socio-economic milieu of the situation of the country. And we have seen that the fertility rate has been dipping. That means the population control measures have been they have become effective, right? Key findings of the report. The first is total fertility rate. Okay. Now what is total fertility rate at the first hand? Total fertility rate is the number of children a woman can bear between the reproductive age of 15 to 45. Okay. The number of children that a woman can bear within the reproductive age on an average. Okay. So that is called total fertility rate. Total fertility rate, there are two important terms. The first is total fertility rate and the second is replacement rate. So replacement rate is that rate of population, that rate of increase of population at which one generation will reproduce itself. If the fertility rate falls below the replacement rate, then the generation will not be able to reproduce itself, right? If we try to understand this, for example, in one generation there were 100 people, okay, and they had, this is called replacement rate. Replacement rate is 2.1 children per woman. Replacement rate is 2.1 children per woman. So if total fertility rate, TFR, falls below a replacement rate, then these 100 people will not be able to produce 100 people, but will be able to produce only 95 to 96 people. This is a hypothetical data that I'm giving. That means one generation cannot reproduce itself if the total fertility rate falls below the replacement rate of 2.1, right? So in India, there has been a lot of debate and discussion on control of the population. Now we are seeing the effects of those measures that the government has taken, and the effect of the women empowerment and basically the education of women. We can observe now that the fertility rate has been declining throughout the country, across the sections of communities and across the states as well. That means not only geographically but also across communities, the fertility rate is now on decline. Okay, the first finding is TFR, total fertility rate, has declined from 2.2 to 2.0 at the national level between NHFS 4 and 5. NHFS, National Family NFHS, NFHS 4 was conducted in 2015-16 and NFHS 5 was conducted in 2019 to 21. In this period, during NFHS 4 in 2016, the TFR was around 2.2. Now the TFR has fallen to 2.0. Okay, and what is replacement rate? It is 2.1, right? There are only 5 states in India which are above the replacement rate of fertility of 2.1. There are only 5 states in India which have TFR greater than 2.1. Okay, they have a total fertility rate greater than the replacement level, and there are only 5 such states. They are Bihar is having highest fertility rate 2.98. देखो, higher fertility rate or higher population is an indication of certain socioeconomic socioeconomic conditions like poverty, poor women education, low per capita income. Because when the per capita income is low, the families will be producing more number of children so that the total income of the family increases. This is what happens in the places where the total per capita income is low. And when women education is low, so women are not aware. First of all, they are married at an early age, and when they are married and at an early age, of course, their ability to produce the reproductive age that they are into increases, and due to the other constraints like poverty and low income, they are not able to take care of themselves properly due to the economic considerations and all, and due to which they go through a period where they are producing more babies. Okay, so Bihar is having a TFR of 2.98. that represents a poor socio-economic condition in Bihar, but still it has improved a lot. Okay, Meghalaya 2.91, Uttar Pradesh 2.35, Jharkhand 2.26 and Manipur 2.17. Only these 5 states are having a TFR greater than the replacement level of 2.1, right? So that is one major finding about TFR, total fertility rate. Now, institutional births and immunizations. Institutional birth means child birth in hospitals or maternal care centers, right? So institutional births has increased from 79 to 89%, and that is a great achievement for us, because the greater number of institutional births take place, the lower maternal and child mortality. Okay, and India is notoriously high in the child mortality and maternal mortality rates. Okay, in rural areas, the institutional birth is around 87%, and in urban areas it is around 94%. Immunization is also very important indicator. Immunization. So 77% of children between the age of 12 to 23 months were fully immunized. 62% in NFHS 4, this data was around 62%. That means most of the indicators have seen a good rise, despite the fact that we have this report was conducted between the period of 2019 to 21. Okay, so it was also a period of COVID. So despite the fact that we have faced COVID and large scale job losses have taken place, migrant crisis took place, despite these facts, all these socioeconomic indicators have been performing well. So 77% of children between age of 12 to 23 were immunized. DD and highest number of immunization is prevalent in Dadar and Nagar Haveli, 95%, and uske baad Odisha 91%, Tamil Nadu 89% and West Bengal 88%. This is an important data to remember. Okay. Other important findings are about women empowerment. A very novel method of measuring women empowerment has been taken. That is participation of married women in decision making in the household. Okay, that shows The decision making basically depends upon the financial ability or economic capacity of the person. That is why most of the men in conventional households take majority of the decisions, because they are the ones who are sorry, they are the ones who are basically earning, right? Of course the situation is changing, it should change, and it is also indicated by this NFHS survey. It shows that the participation of married women in decision making of the household has increased. Okay? The first important, we have taken three important parameters to measure their participation: the taking health care of for herself, making major household purchases, visit to her family relatives. Okay? So these important decisions are like mostly taken by women, or mostly taken by men on behalf of women themselves. Okay? So healthcare for herself means a very important part of this indicator or this parameter is her ability to make a choice. Okay? Make a choice of having children. Okay? The ability to make a choice of having children, as to how many children they want to have. So women are now having a major share of women are increasingly active in making that choice for the household. Now it is not only the in-laws or the husband who makes that choice, but also the women participation has increased in that sector. Okay, making the reproductive choices for the women herself is one of the most important part of their bodily autonomy. Okay, and that shows a great deal of women empowerment. Making major household purchases, ठीक है, like fridge, other household purchases, तो ठीक है, such purchases take a good amount of capital. ठीक है, तो economic decision भी यहाँ पे women are going to take. तो the economic participation also has increased. And visit to her family or relatives, that shows the freedom of choice, the freedom of like mostly in the conventional old households, that freedom, that this kind of decision mostly taken by in-laws, father-in-law, mother-in-law. Now that the participation of women in making that decision is also increasing, shows a great deal of women empowerment. Okay, so 80% in Ladakh and 99% in Mizoram and Nagaland. So these are like for Union Territory, 80% highest in Ladakh, and for states Mizoram and Nagaland, because Mizoram is of course having a matriarchal system. So of course they are naturally going to have a higher degree of women participation in all these decision makings. But still Mizoram and Nagaland are the two states which have a fair degree of participation of women. That means women empowerment, right? The percentage of women having bank accounts, this is also very important socio-economic indicator of having bank account. Having a bank account shows the economic power. Okay? That has increased from 53% to 79%, thanks to a lot of schemes that have been brought in last 4 to 5 to around 10 years. So, okay? So that means women empowerment has substantially increased. The last parameter that we are going to observe is about stunting, overweight and obesity. Okay? Stunting means lack of not growing in height with respect commensurate with the age. Okay? Wasting is about weight, stunting is about height, right? एक एज के स्पेसिफिक अगर हाइट आपकी नहीं ग्रो होती है आपके चाइल्ड की, दैट इज कॉल्ड स्टंटिंग. Overweight and obesity, why are we measuring overweight and obesity? Because now India is shifting from major communicable diseases to major deaths are now happening from non-communicable diseases. Okay? And overweight and obesity are one of the major reasons of like heart diseases and kidney failure, liver disease and all these diseases. Okay, the stunting among children under 5 has marginally declined from 38 to 36%. The decline is marginal, not very much. Higher among children in rural areas. तो रूरल एरियाज में ड्यू टू लैक ऑफ न्यूट्रिशनल what due to lack of the nutritional food, the access to nutritional food, the stunting is higher in rural areas. It is around 37%, and urban areas it is around 30%. Stunting ranges from the lowest in Puducherry, ठीक है, Puducherry में stunting is lowest and highest is in Meghalaya. Highest is in Meghalaya around 47%, right? Now, what is NFHS 5? So, NFHS is a National Family Health Survey. It is conducted by Indian Institute of Population Sciences, which is located in Mumbai. ठीक है, तो that institute conducts a sample survey. ठीक है, तो this year they took around, this time they took around 6.37 lakh sample households from 707 districts of country from 28 states. ठीक है, तो what is important? They took around 6.37 lakh sample households to make it a representative of throughout the country, for whole country. They distribute the districts or the households across geography, means across the states, ठीक है, so that the result is a representative data of the country in itself. ठीक है, तो what are the novelty in the fifth round? Novelty means what are the new things that have been brought in the fifth round are expanded domains of child immunization. ठीक है, तो the number of vaccines that were considered earlier has been increased. Components of micronutrient to children, stunting and wasting measure करने के जो parameters थे, they have been changed. Menstrual hygiene of women, of course, in the reproductive health of women, in the section of women empowerment. Frequency of alcohol and tobacco abuse to measure the socio-economic impact of these ills, alcohol and tobacco. Additional components of non-communicable diseases, NCDs. Okay, now for measurement of non-communicable diseases, we are measuring what? Obesity. Okay, obesity and overweightness, and expanded age ranges for hypertension. Now hypertension and diabetes have also been included, and the range of age, it was earlier also measured, but in elder people. Now it has been, the measurement has started from the 15 years itself. Okay, understood? About NFHS, it is a what? It is a sample survey. Sample survey means it is not a survey of the whole country, but it is a survey of a sample taken from the whole country. ठीक है, and major indicators that are measured are fertility, infant and child mortality. Okay, the practice of family planning, maternal and child health, reproductive health of women, nutrition, anemia, quality of health and family planning services. Okay, and it is conducted by Indian Institute of Population Sciences located in Mumbai. So the whole survey says that we have made gradual, we have made like a progress in all these socio-economic parameters. We should now, despite the fact that we faced a COVID situation in India, across the world also, we have not fallen down, rather we have made advancements in and progresses in these socio-economic conditions. Okay.